why aren't doctors, GPs, gynas, why aren't they referring these couples onto a specialist? It seems like a long time to be sitting and thinking that everything is fine. What are they doing in those 4 years?
It's a good question.
Yeah.
And I don't know. I think that you don't want to be alarming people early, and you don't want to be over investigating. I think that there's a polarization, or there's two extremes. So the one is the woman or the couple that have been trying to conceive for a month, and now they rock up and they don't really have anything wrong with them, and it's too early to be investigating. But if the couple have been trying to conceive for a year, if she's less than 36, or if for 6 months, even if she's older than 36, she should be investigated, or the couple should be investigated.
All right. Did you have something to add, Megan?
Part of our Reproductive Health Month campaign is our slogan is, will your fertility stand the test of time? And with the help of a few fertility specialists at SASREG, they came up with a list of warning signs. So we can't necessarily change the referral process with gynecologists or GPs, but we can empower the patient. If they tick any of those warning signs, we encourage them to go see a specialist to get a fertility workup instead of staying with their gynae or their GP. So we don't necessarily have the power to change that, but we can empower the patient.
What are some of these warning signs? What are some of the most prevalent warning signs that couples should be looking out for?
So I guess that you're wanting to know that the woman is having a regular menstrual cycle, or looking at her menstrual cycle and her menstrual history. So irregular cycles suggest that she may not be ovulating, and significantly painful menstruation that's impacting on her quality of life, that's leading to her being away from work, or significant pain with sex, suggests that there may be a mechanical issue, something like endometriosis, something like a pelvic infection, which would have affected the fallopian tubes. So looking at her menstrual history. Unfortunately, things like being overweight, an existing diagnosis of diabetes, polycystic ovarian syndrome would lead to not ovulating. Other medical conditions, on certain medications that can lead to irregular cycles. Past history of sexually transmitted infections, or pelvic infection, or pelvic surgery would be things to think about. And then if there's any discharge from her partner, if he's got any swelling of the testes, if he's had medical conditions when he was young, something like mumps, all of those are things to think about.
Wow. Now, what are some of the options that couples who are struggling with infertility have to them?
It depends on it depends. So in terms of fertility treatment, it will depend on what the underlying cause is. So they first need to be investigated, and to see what in order to make a rational assessment and treatment plan. And one would like to do the least invasive, least costly intervention that is appropriate. So if the issue is just a problem of not ovulating, we can use medication to induce ovulation. If there's a mild male factor and the fallopian tubes are working, we can do something called artificial insemination, where we inject the sperm or into the uterus. And unfortunately, if the fallopian tubes are damaged, or if there's a severe male factor, then we're looking at IVF in vitro fertilization, or ICSI.
I think the other options besides the treatment is also couples can look at adopting. And the third option, which is really never spoken about, is you can also choose to live without children. And that's very much a silent group internationally, not only in South Africa. I think women are shunned when they make that choice. But you must know that once people get to that stage, they've been through a very long process. And you know, we all follow different paths in our life, and it's not to say that one path is more important than the other. So it's also to grow awareness and understand what the couple has gone through to choose not to follow more treatment or adoption.